Welcome to my channel NutraManagement. Today we discuss about obesity and type 2 diabetes. Both are metabolic disorders. All of you know that obesity is a metabolic disorder. Type 2 diabetes is also a metabolic disorder. And throughout the global basis, both the obesity and diabetes type 2 are increased day by day. And WHO also give several precautions to check the obesity and diabetes at the global basis. Lifestyle is the major factor for the onset of the obesity as well as the type 2 diabetes. And for that reason, at present, WHO named both these metabolic diseases as lifestyle diseases. In this discussion, I like to discuss briefly about the different causative factors of diabetes as well as the obesity and what is the linkage between the obesity and type 2 diabetes. And lastly, we like to focus that how we can able to manage the obesity and type 2 diabetes. Now, first one, what is obesity? Obesity, that is the excessive accumulation of body fat that may adversely affect our health. And the most important indicator for the obesity is the BMI, that is the body mass index. This BMI more than 30 kilo per meter square is generally classified as obesity. And there are different types of obesity, like mild obesity, moderate obesity, severe obesity, super obesity, super obesity. Out of these obesity, there are also different types or classification on the basis of the deposition of fat in our body. That is the upper obesity, which is known as abdominal obesity. It is known as android obesity, or it is known as the male obesity. And another one, that is the female, which is known as the gynoid obesity or pear-shaped obesity or lower obesity. But out of these, abdominal or visceral obesity, which is noted is mainly in male candidate, that raises so many health risks, like it is responsible for infertility, it is responsible for cardiovascular diseases, osteoarthritis, etc. And this upper obesity or visceral obesity is noted mainly in female, mainly in male, and for the reason male are suffering such lifestyle diseases or metabolic diseases than the female. Now, what is type 2 diabetes? Type 2 diabetes is insulin resistance diabetes. That means though the pancreas has the ability to synthesize and secrete insulin at the normal level or more than normal, in spite of that, there are some defect, mainly genetical defect in the insulin receptor. And thereby, the insulin is unable to execute its proper action on the target cell. Insulin main action is the carbohydrate metabolism, but due to the insulin resistance, carbohydrate is not metabolized properly. And thereby, the blood glucose level is elevated, and that also raises the diabetes. So insulin resistance diabetes is actually the type 2 diabetes. And if such type 2 diabetes is not controlled properly, then it results several complications in heart, in kidney, in eye, in nerves, and the blood vessels. So these are the complications of type 2 diabetes. Now we'll have to discuss that what is the relationship between obesity and type 2 diabetes. When the excess fat is deposited in the different visceral organs, that is the internal organs, then the insulin resistance is developed. That means the target cells can able to act at a low level to insulin. And that is referred as insulin resistance. And due to such interference of insulin action on target cell, the glucose is unable to metabolize properly. So there is a high chance of accumulation of the glucose in blood, and that results the diabetes. So obesity mainly results in insulin resistance, and that may lead to diabetes. Now, what are the major risk factors for such obesity as well as diabetes? Overweight and obesity, that is the abdominal obesity, is the most important risk factor for diabetes. Physical inactivity is also another risk factor for obesity as well as the diabetes. Unhealthy dietary patterns is another cause for obesity. Unhealthy dietary patterns, that means if we are very much habituated with intake of fast food, junk food, processed food, preserved food, canned food, where saturated fat is maximum, where the minerals and the vitamins which are anti-diabetic in nature are minimum, that may enhance the possibility of the diabetes. Another one, the family history, that is the genetical factor for the diabetes as well as for the obesity. Both are responsible and linked to the genes. Similarly, high blood pressure is also associated with the obesity as well as the diabetes. Poor sleep, chronic stress are also the risk factor for the diabetes as well as obesity. Now, what are the major health consequences due to such obesity? Now, cardiovascular disease, heart disease, stroke, kidney disease, neuropathy, nephropathy, retinopathy, peripheral nerve damage, fatty liver, joint and mobility problems, all are responsible for the obesity. Now, prevention is the most important strategy for the protection of the obesity as well as diabetes, because both the obesity and diabetes is a public health problem. So important aspect is the prevention. How we can able to prevent the obesity as well as the type 2 diabetes? That means if we prevent the obesity, then the type 2 diabetes incidence and prevalence rate must be decreased. So for the prevention of obesity, healthy diet is the most important factor. Vegetables, daily intake of fruits, whole grains, legumes, appropriate protein, healthy fat, that means the unsaturated fat, all are related for the prevention of obesity. Similarly, adequate sleep, stress management are also important for the prevention of obesity. So people with overweight or obese even follow a healthy lifestyle for the reduction of the body fat, then we can able to manage not only the obesity but also the diabetes. Now, screening and management, how we can able to identify that the individual is suffering from diabetes. Fasting plasma glucose. If it is more than 126 mg per dl, as per WHO reference value, that individual is suffering from diabetes. HbA1c, that is the glycated hemoglobin level, if it is more than 6.4%, then the individual is also suffering from diabetes. Oral glucose tolerance test, when 200 gram of glucose is also given to 250 ml of water, and within 2 hours, if the blood glucose is not achieved the normal level, then the body tolerance capacity to that exogenous glucose has been lost, and there is a high susceptibility to diabetes. So, if we summarize this total discussion, first point, obesity and insulin resistance are strongly associated with the type 2 diabetes. Second point, obesity is an important but modifiable risk factor for obesity, for diabetes. Obesity is a modifiable risk factor for diabetes. That means we can able to modify that obesity. Third, healthy eating, regular physical activity, appropriate weight management adequate sleep, and stress control are involved for the reduction of metabolic risk, that is the obesity as well as diabetes. Early screening, proper management can help to prevent or delay both these complications. So, what is the conclusion? Obesity and type 2 diabetes are closely connected conditions, but their impact can be reduced through prevention, early detection, and appropriate management. So, the message can be disseminated to the society for prevention of this public health problem. That is, healthy habits today can reduce health risk tomorrow. Thank you, everyone.